This is our neck pain recovery talk today at the Gibson Center. We're going to talk about how to assess the problem, figure out if your symptoms are coming from the neck, and see how to fix it. How do we stretch? How do we exercise? How do we worry about our posture too? Our posture. Let's get that fixed. So to start running into it for 1, 2, what causes neck pain? Okay. What are normal causes, you think? Could it come from trauma, injuries, car accidents, falls, things like that? Run into a wall. It can happen. Walls move and get into your way. We get that real quick for you.
Sleeping position. Sometimes I wake up with a bad neck. And I don't know what kind of pillow to get.
Well, that's the thing is when you're sleeping, it's not the, and what I commonly see, it's not the bed, it's not the pillow, it's your neck. People spend, how much does a bed cost, like a Tempur-Pedic bed cost, right? About 10 grand. I don't want to spend 10 grand on a bed. So I'm going to make sure my neck is good, my back is good. People wake up, I had someone come in this week, on Monday, I woke up with a bad neck. Yeah, it wasn't your bed, it wasn't your pillow, it was your neck. Let's make sure we took that picture. So something traumatic or non-traumatic for 1, 2 right now is raining. What happens when it rains? Do people drive better or worse in the rain? Worse, right? So we want to make sure who's behind us. We don't know. We don't have to have good brakes or good tires. So if you're in an accident that's traumatic, it can cause a whiplash in the neck. Your head whips back, then whips forward. You can fall down and hit your head. I have people that come in, especially in football season, are playing football or cheer, have head injuries, neck injuries. A head injury, concussion, where does all the impact hit? Maybe the head, but the neck has to whip to release that pressure. Another injury talked about too, going to the gym. People lifting too much weight, causing stress on their neck, which when I say too, is if you go to the gym, to go to exercise, and it causes a neck problem, that neck or lower back already had some pressure in there, you just overloaded it. It let you know what was going on. That's the biggest thing. The gym's not your enemy, it's not evil. Working out is not evil. Doing yoga, Pilates is not evil, but it's going to wake things up that were there, and you have to get better. Get yourself looser, stronger, feeling better, and feeling like you can endure your day. That's the plan. Okay? Next one too is poor posture. What's poor posture? The biggest thing I've seen during COVID, this last couple of years, is this. Sitting at home, working like this. Or on your phone like this. Okay? So what happens when you do that with poor posture, then your body hunches forward, your neck muscles then creep, your shoulder muscles then creep up to the neck, making your neck pinch, causing compression in your neck. So we want to do, we'll walk them into as a preview, we want to sit back in a chair, our shoulders back. I tell people the back of the chair is for decoration. You want to sit forward with your body up here, not back here. Because we go from here to the back of the chair, we start doing this. After lunch, we start doing this. We take a nap.
I don't know right now.
So we want to do, ideally, sit the first third of the chair, feet underneath you, legs or underneath, below your hips, your body up. So your body with the lean back, so your shoulders roll down, head stays back, so your body can have this normal standing position here, sitting, like here, standing. So we'll work with some of that today too. You have to reset the brain where normal should be versus your normal now, if that's your problem.
But wait, I want to be comfortable.
I'm good.
You're telling me not to reach the back?
I'm saying sit up straight. If you want your back and neck to be good, here keeps it strong and relaxed. Here, it causes you to have poor posture. When we say poor posture, it's body inflection tightens up. Muscles get shorter. If that happens, your neck tightens up, builds up pressure, causing neck pain, causing shoulder pain, causing headaches, causing a lot of stuff we'll talk about in a second. All right? Next thing, lifestyle habits. And that's part of exercise too, or the lack of exercise. Are we doing enough for our day to handle the stress of our day? We have a physical job. Do we do enough to stretch throughout the day? Or after your day, before your day? If you don't have a physical job, are we doing enough to build up muscle to endure our day. Endure how much we want to sit, how much we want to stand, how much we want to, if you want to work around the house. Are we doing enough? I don't know. But whatever's for you, are we doing enough so you feel in the day, okay, I'm okay. I'm not like I'm exhausted. My body hurts, my body aches. I do a lot, but my body hurts. Once you get that long enough, you get weaker and tighter, weaker and tighter. That snowball effect, you go to your doctor and tell her that, your medical doctor, you're going to say what? If your body hurts, what's the medical approach normally if your body hurts?
Rest.
Rest. Don't do anything. Be careful. Lie down. I had a patient named Rachel, tell a story a couple times a year. She came to me. She's in her 60s, not very old, a little Hispanic lady, and she had bilateral leg pain. She could barely walk. She came in a wheelchair and tried to get into a walker. Very weak. I go, Rachel, what happened? She says, well, I took her x-rays. In my office, took her x-rays. X-rays are normal. I'm like, Rachel, your back's okay. What happened? I saw my doctor 6 months ago, come out in back pain. He told me to stay home and rest. And take some medication. I've been doing that for 6 months. Now my body's weak and tight. I can barely stand up. So I want to do the opposite. I want you moving more, get things looser and stronger versus weak and tight. Within I'll say about 2.5 months, 3 months, she went from being in a wheelchair walker, being able to get to the door back and forth. I told her, Rachel, if you want to get better, if you don't want to end up in a bed, a nursing bed, you have to start walking. But it hurts. I'm like, it's going to hurt. Sorry. So I treat her and check with her once a week. She goes, I think she said something, a curse word in Spanish, so it wasn't very good. But she's like, I don't like you, but I like you. Because you're making me feel stronger, but it hurts. She understood being hurt and pain and really more uncomfortable got her stronger. Now, last I saw her 6 months ago, she walks about 45 minutes a day, no walker, no cane. She knows now that's going to keep her healthy. But how do we change the mindset, what's going to take to get healthy, and then maintain that habit, that lifestyle? Okay? Symptoms of neck pain. What are symptoms of neck pain? Next line down there. Pain around the neck, right? Okay? Where is the neck? You want to kind of visualize it from the base of the skull down to your shoulder, but also includes your upper back along with out to your shoulder. Okay? Also included is the front of your neck and then part of your clavicle in the front. I include that all in because those muscles and those joints all work together. They work together, that's part of your neck complex for 1, 2. So we want to make sure all these muscles, are they sore? Are they weak? Are they painful? Does it affect your breathing? Does any of that limit your shoulder motion for 1, 2? Any of it cause, if it's nerve pain coming from the neck, is running down the arm or down the back or in the head, causing pain, tingling, numbness, or weakness. Those are nerve symptoms. People come in with neck pain, but they also have severe headaches. Headaches that go from the back of the head, forehead, even behind the eye. Even dizziness, even vertigo. That's all part of it too. So, and how do we, from there, for 1, 2, how do we assess the neck? How do we kind of examine everything too? Okay? So we want to look at is someone's posture, someone's range of motion, their movement patterns. Also, if need be, we can take an x-ray too to see what's going on. All right? Is she locked out? Oh. Come on in. You're welcome. You're welcome. If you want to sit over here, you can. I'm not going to use these 2 tables over here. All right. All right. There we go. There's the mechanic. There's the mechanic over there. It's a little loud back there. That knitting group up there, they're crazy over there. The knitters. You want to sit over here on this side? Oh, yeah, you're good. We're good. I'm not going to use that one. Okay. Who wants to be my model for the assessment? Anybody? Anyone be my model? Yeah, come on over. Yeah. Sorry, yeah, not a problem. Come on over. All right. So, grab a seat. What's your name again?
Sally.
Sally, how are you doing, Sally?
I'm doing okay.
Grab a seat. So tell me how you normally sit.
Oh, I don't sit like this.
How do you normally sit?
There you
not
are.
Bad, not bad,
You got
not
the
bad. When you're doing that, Sally,
Yeah.
your shoulders are rolling forward.
I know.
Okay, your head, because of that, will kind of roll forward. Your upper back a little bit more, too much. If you want to call it arch this way a little bit. Okay, that's part of it. When you do that, at that point, these muscles in the front, the pec minor, anterior shoulders, to tighten up. The back, and because of that balance issue, tighter, weaker back here, weaker posterior delt, weaker upper trap that goes from your shoulder joint up to your neck to your upper back also. So weaker here on both sides. Up here at the base of the neck too, these muscles will tighten up. These muscles at the base of your neck, they tighten up because your neck doesn't want to fall forward. That would look weird. You wouldn't be able to see people in front of you. You'd hit people. Okay? So they tighten to cause pressure in that area too. Okay? So scoot forward for me. Scoot forward. Right there. Range of motion. We talk about range of motion. What you want to do is test left, test right. Ooh, tighter left. And also back, forward, and also rotation. So what I'm seeing with Sally, she's tighter left and tighter back. And no shoulder neck problems, right? No shoulder injuries?
Sometimes.
Okay, tighter up here?
Yeah.
Yeah, that happens too. So if this is tight in the neck, what will happen too is we'll be tight in the shoulder also.
Okay.
So we're going to be tight. If we're tight here, that correlates with a tight muscle here to hold your head up, along sometimes with a tight upper back. Again, tight front muscle and weak back muscle. Some people come in, yeah, it's neck pain, but I have a shoulder problem also. Want to treat both at the same time. That's the issue. Okay? Stand up all the way. And now, when you stand, we're going to do the same thing we're going to look for. Is the body rolling forward or is it rolling backwards? So with your hands, bring your hands out like this. How does that feel?
I feel fine.
Good. It helps the shoulders now unwind this way, that way. That shoulders back here. So now check your standing posture. Let's go over here for me. Against the wall over here. Go here. Just bring your heels, hip, shoulder, head against the wall. Let's go right there. Let's see how that looks. Sally, how's that feel? Weird?
Well,
Well,
yeah, it's okay.
it's okay?
Yeah.
So we bring your heels, hip, shoulders, head back against the wall. Now bring your hands out, open
Okay.
palm. There we go. Helps those shoulders get stronger here
Oh, okay.
versus being tight and weak in the front. Now take a step forward for me. Keep the weight on your heels. Does that feel weird? Feels okay?
I feel okay.
Good. By holding your posture up here, it helps the shoulders drop, helps your shoulders rotate backwards, helps your head come more over your shoulders versus being stuck forward. Got some work to do. We're good now. We're good. Grab a seat, the better posture position,
We need to
ma'am.
be mindful.
Yes. Yep. All of it. Your being against the wall helps your whole body reset your posture to an ideal position, or lets you know where the problems are. And by walking with the weight on your heels this way, now our body can reset the muscles to get stronger here, and then the muscles to reset themselves here. It's going to be a little bit sore, a little uncomfortable as you go through that, but that's how you know you're doing the right thing. Again, we want to be uncomfortable to get ourselves stronger and change our body's position to sit or stand. That's the big picture. Any questions yet? Okay. All right. Now, the assessment's done. How does chiropractic, physical therapy, how is seeing a doctor or a physical therapist, even a trainer, help you? Okay. What we want to do is focus on, for someone who has a problem with neck pain, is checking out if it's neurological or is it muscle, or is it structural. So we want to make sure our body is going to reset here. And if we do the exercise, we're going to go over in a minute in stretching too, if you're exercising on your own and it hurts, then go see someone. If you're exercising and stretching the right way, that means your body can't stretch to where it should, where at that point it's something stuck inside. And especially if you're having nerve pain we talked about before, right? Nerve pain of numbness, tingling, burning, anything down the arms, or even in the head causing headaches, make sure you see someone to get a full exam. And if need be, x-rays too, to make sure there's nothing going on you can't see without imaging. All right, that's my 2 cents, what we do. Okay? Starting with these stretches here, the pillow stretch. I've done these before if you've seen my talks before. I'm going to put this camera over here so it's easier out of people's way. Here, this one. This one here allows your head to start falling back slowly without causing stress for your body. I always start my patients with exercises lying down, because one thing they're easy to do, but they also take the pressure of your body weight off of your spine, meaning that here, if I'm standing, what's pushing down on my neck when I'm standing? My head. Boom, easy, right? When I'm lying down, there's no pressure like that. So first stretch here, we take a rolled up bath towel, okay? Hence, a bath towel or a beach towel, I think. Okay? Here, I want to put this towel at the top of my shoulders back here, allow my head to fall back over my body. And then go here. A little bit higher up here. Head fall back. Right back here. That allows, again, the head to fall back behind the body, help that neck curve backwards more where it should be versus stuck front of your body. You want to do 1 minute here, with your legs straight, arms at your sides or across your body. And the second minute will be your arms above your head. Okay? Allows your whole body to stretch, like we talked about a second ago, an extension where the body can get more flexible, more movement, versus stuck in flexion. Okay? Any questions about that?
Is that exercise?
Yep, it's more of a stretch. So the first one on that paper is called the pillow stretch. That's that first one. The it's going to be just a repeat. You're going to do a minute, or even start with 30 seconds if you're more comfortable, on something that's a hard surface so you don't sink into it, with that rolled up bath towel behind your back, head flat, feels good. And then second would be your arms above your head. Your whole body stretch to extension. So that point you're going to do is decompress your body, your neck, your spinal bones of the neck, allow your body to extend backwards. All right. Any questions about that?
How long do you hold that position?
Start for about 30 seconds to start, then go to a full minute when your body's ready. Someone has neck pain or neck soreness, recommend doing it before stretches before you go to bed and when you wake up in the morning. Okay? When we sleep, do we move when we sleep normally a lot? We don't move a lot when we sleep, but it kind of tighten itself up. So morning and night is a good start to stretch until it feels better. All right? Questions?
Is this for your neck pain and your back?
Neck pain. Neck and more upper back. So if I'm hunched this way, I want to make sure my body goes the other way, get the stretch. And by lying down, your body can open up slowly and not feel full compression. More an easy way to get yourself into it.
I'm sorry, I'm deaf. 1
You're
minute?
good.
1 minute?
Well, start with 30 seconds. Begin with 30 seconds. You position arms at your side and then above your head. And then go up to a full minute.
Oh.
No more than 4 hours at a time, though, okay? Careful with yourselves. Next one, corner stretch. I'm going to do it here on the wall, just here. You could use a corner like the one back here. Here. Take you 2 seconds. Here. This corner back here, what we want to do is put your hands about shoulder height here, and then bring 1 foot forward. And then you want to lean your body into the wall, keeping your body level the whole time. Just like that. Okay? The corner stretch will allow the muscles, if we're tight in the front, right? Allows the whole body to open itself up. Again, so here, people can see it at home. I want to sometimes, I guess. I don't know. We'll see. Here, hands shoulder height, feet together. Bring one, doesn't matter which foot it is, head up the whole time. Bring your 1 foot in toward the corner of the wall. Your body slide into the wall, stretching your front muscles of the chest, your pec minor, and to your delt. Get the upper back to pinch together in relaxed state. You're not forcing it, so the whole body can stretch to get more open that chest to get your body to be more upright. Any questions about that one?
How many?
I would do 5 and hold each one for 5 seconds. 5 and 5. Not 5, 5 and 5, just 5, 5. All right. All right. Good? Who want to try that? Anybody want to try it? Easy one. Come on, yeah, come on. Let's see. Let's have you try it and see. Might as well. Right there. Good. Oh, hands down. We're not getting robbed here.
Oh,
Right
okay.
about here. Not getting robbed. And there, and then up. Most people do this too. Keep your head up the whole time. There we go. Now slide toward the wall. Bring your foot forward. Bring your foot forward. There you go. There. And then come toward the wall. Pinch back here too. Pinch, 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 pinch. How's that feel? Good form. Good form. Come on back. And try it one more time. Good. Good. Perfect. Come on back. Where do you feel that stretch?
Right down the middle.
Where it's tight right there.
Yeah.
And at home, again, hold for 5 seconds. Keep the head up the whole time.
How long do you do it? I mean, okay, 1, 2, 3 times?
I would do like maybe 5 times.
Oh, okay.
Hold for 5 seconds and do it 5 times. There we go. Good. Keep that body, feel that stretch back here. Good. And bring your hands a little bit lower, more shoulder height. There we go.
And I'm going to push against the wall here, coming back.
Actually, no. Just let your body glide into more of a stretch. Hold, and let your body glide back.
Oh, okay.
The more we relax, the more we get the muscles and joints to stretch. The more we kind of contract and contract the muscle, we're going to kind of fight ourselves. We want to cause more motion, not limit motion.
Okay.
Yeah. Good.
Alrighty.
Good work. Good work. Good work, team. Look at that. All right. Next one, upper trap stretch. This is an easy one to do. I'll demo this one. I don't want you guys hurting yourselves. Here, if I take my neck, right? If I have forward head posture, if my body is tight in the neck, causing pain or tightness or weakness, whatever it might be, I want to make sure this whole muscle there on the sides of your neck, they get to stretch. So you can do it in your own chair if you want. Bring your left hand behind your right ear. Right back here. Make sure your hand goes over your head. Then turn your head to your right shoulder. Other right. You got it? Good, good. Then from there, let the weight of your arm pull your head down toward your body. Good, good. Right there. Okay. Hold that stretch, perfect. And let that head, hold that for about 30 seconds on that side. Good, turn. We'll go here. We'll go here. Turn first. Turn. Your head coming down. There we go. There we go. Oh, there's the face. Little stretch. Once you've done that side, then same thing, switch sides. Turn to the other side. And then bring your right hand behind your left ear. Turn your head to your left shoulder. The weight of your head, the weight of your arm, pull your head down toward your body. Boom. Okay? This is a stretch you can do throughout the day, not just morning and night. And hold that side, both sides, 30 seconds, just once. That's it. Good. That feel good? A little bit tight. If it feels tight, you got to do it. That's all it is. You got to do it if it feels tight. Okay? Next one. Now if someone is in pain, I may have them just do these 3 exercises until the pain goes away. Why is that? You start to lift or do strength exercises when we're in pain, it's going to make it more sore. I want to make sure the body can handle more load, more stress with some exercise once their body's ready. So there's a time frame you want to watch. If I'm sore, you can make sure I stretch, maybe ice. Once the soreness goes away, it's just tight, then you can start some strength stuff going on. All right? Next one here, 3 shoulder exercises. Okay, I have some professional weights here that you might have at home called water bottles. Okay, you might have these, I'm not sure. Okay, these are going to help you get stronger over time to make your body want to stay healthy. What I want to do now, talked about earlier, is getting these muscles here stronger in the back of your shoulders. That point it pulls your body back more. Once someone's out of pain, I'm going to give this exercise called 3 shoulders. I'm going to go against the wall. Number 1, you shoulder exercise here. Elbows together. Elbows next to your side. Elbows do not move. And bring your hands with the water balls in them, pointing up, all the way out. Hold for a second. Then come all the way in. Okay, that's number 1. So don't do this. It's not a wing thing. I don't know what this is. Something, no. If we do this, we're cheating. When we start, we may only come out here. That's fine. But allow it to come out more and more and more. So you're stretching, yes, you're stretching the front muscles, We're also making your posterior delt upper trap stronger. Also back in your upper back, what we're going to do is really pinch them together as you come further out. Hold that for about a second, then come back in. Repeat 5 times. So again, elbows in to your side, hands come out to your side. Hold for a second, then come back in, making sure in your upper back we're pinching that whole time. I have someone start on the wall first because it allows you to hold that better posture position, right? We're here, we know where our body is, getting the body to reset and stronger here, not here. So you want to make sure we really focus on posture this one too. Okay? Number 1. Number 2 of 3 shoulders exercise. Elbows shoulder height this time. What we do now is allow those hands to come above here. So your hands are facing out away from you. Hold for a second, then come back down. Again, we want to make sure our elbows stay straight the whole time. Rotation occurs only through the shoulder itself. If you have shoulder pain, watch out how much you do. Only go where you're comfortable. Coming up, you maybe start here. Feels good. But don't cheat and do this. This is more of some type of dance move or something. I'm not sure some of the dance move. All right? So here, shoulder height, elbows at your shoulders. Come all the way back if you can. Hold for a second, then come back here. This will be hard if you have your shoulders rolling forward a lot. So just go where you're comfortable. Okay? Last 3 of 3 shoulder exercise, okay, is going to be now, you keep the hips on the wall. Instead of being flat on the wall, we're going to do now, bring your feet off the wall. Hinge at your hips, leaning forward, keeping your back straight. Hands with the water bottles in them pointing forward. That what we do is bring the hands as a reverse fly all the way up. Shoulder height, in line with your head, then come back down. Okay? So one more time. We're going to start against the wall, hips against the wall, bring your feet out, off the wall. At the waist, hinge. At that point, back stays straight. Bring your hands facing outward or thumbs facing forward in front of you. Let your elbows come up. At that point, reverse fly. Hands shoulder height. Pinch shoulder blades together and come back down. So the goal with this one is make sure back here in your upper back now, all up here, we come up, we pinch, hold, head up the whole time, and then drop them down slowly. Hold that for 1 second. All right? Woo! It's getting warm in here. All right, any questions yet? Again, 5 seconds, 5 times, hold for a second, then come back down for all 3 exercises. Okay, last one for now, shrugs. I like using some light weights, maybe water balls, can soup, whatever you want to use. Want to do is start against the wall. We want to do a modified shrug. We want to do just this. We want to make sure we do enough to make that body again open up, shoulders to drop more. We're going to do, with the water balls in your hand, make your hands face out. Open your hands up. And from there, what we're going to do now is hold those water bottles tight. Bring the shoulders just straight up. Hold, and all the way back. Try to keep your head, the back of your head, on the wall the whole time. Want to come up where you feel comfortable. Hold for a second, then come back down. This one, you want to do about 10 of them. Okay? And why do you want to do this one? These 2? We want these muscles stronger. Your upper trap muscle attaches the base of the neck to the shoulder, upper back, because those muscles help us endure standing and sitting. They help your body stay back versus roll forward. We want to make them stronger. So again, the shrug again, last time. Hands open with the shrug against the wall. Let your shoulders glide up. Hold for a second, and then come all the way down, keeping the head against the wall. All right, any questions at all? That's the goal, is can we endure how much we sit, how much we stand. So if these are stronger, once you feel better, once the pain's gone, and then you can sit and stand longer without being in pain. How often should we do these exercises? What do you think? Once a week, once a year?
Every other day.
St. Patrick's Day, maybe?
Every other day?
Every day.
Every day.
I tell people every day. Because you're going to skip one.
Once a day.
For the exercises, these, once a day. Stretching if you're, again, it depends where you are, right? If you're not in pain, once a day is going to be good. If you're in pain, focus on stretching twice a day, and then these maybe once a day if it's not painful doing them. Again, strength exercises are meant to get stronger, but if you're in pain, you got to hold off until the pain goes away. I tell my young kids, patients, do them on just 8 days that end with Y, which is every day. If you miss a day, you're not gonna whatever, but you want to make sure you have consistency with your habits. Right? We talked about very top right corner. It talks about lifestyle exercise habits. Can we form habits for you, whatever your lifestyle is, to keep your body loose and strong to endure your day, the stress of your day? And there's good stress, bad stress, right? Whatever stress it is, can we end our day where we feel good? Yes, ma'am.
How do you modify the exercise? You can't stand up. You're weak. Stand up. You can sit down.
Good.
How do you modify?
Good. So I would do this one. Good question. Here, I would modify the 3 shoulders by sitting in the back of the chair now, here, and now hold the water balls to your side. Come straight out. Okay, number 1. 2 of 2, shoulder exercise here, shoulder height, all the way back. Hold. But make sure at the same time, we're against the chair, the head straight the whole time. We're keeping our body, everything's still besides the water bottle's moving. That's all it's going to move. Here, number 1 again, hands come out, elbows tucked in. Number 2, elbows shoulder height. Water balls move up, head stays straight the whole time. The last one, instead of being on the wall, we're going to come on the edge of the chair, if possible. And now here, head straight, upper back straight. Come straight up. Bring those water balls up. Make sure back here we're pinching the back of the neck the whole time. So it pinches, hold, and then relax. Be easy to modify. Last one, the shrug exercise. The last one, same thing, sitting on the edge of the chair, so our body straight the whole time. Hands open, facing out, coming straight up. Hold, then come straight down. Make sure that head, that upper body does not move. All it's moving is just your shoulders. That's it. Hold and relax. And again, this is open hands to make sure the body's staying here, not here. Get your posture set first when you do exercises, and then do the movement. Good? That's the plan. We have to keep things moving. Again, I'll put all this stuff on YouTube afterwards, probably tonight, from this workshop. You can see it there again, too. If you have any questions, let me know. Good? Stay dry, my friends. This is crazy weather we have here in Southern California, right? Well, I'm good with the rain, too. Just people want the sun all the time. Crazy.